7 signs you can ignore. Cancer 7 warning signs. Change in bowel or bladder habits, a sore that does not heal, unusual bleeding or discharge, thickening or lump in breast or elsewhere, indigestion or difficulty in swallowing, obvious change in a wart or mole, nagging, cough, or hoarseness. Breast cancer, a malignant tumor that starts in the cells of the breast. A malignant tumor is a group of cancer cells that can grow into surrounding tissue or spread to distant areas of the body. The disease occurs almost entirely in women, but men can get it too. Last time. Signs and symptoms. Abnormalities in breast tissue, lumps, dimpling, thickening, breast skin, risk factors. Inheritance, genes, aging, obesity, smoking, cigarettes, drinking alcohol. Detection, 3 methods. Breast self-examination, a method used by breast physicians of feeling around the breast for lumps and abnormalities. Breast clinical examination performed by healthcare professionals. Mammograph, the process of taking x-rays of breast tissue to detect the malignant growths. Breast self-exam. Examine your breast in the shower. Examine your breast in the mirror with your arms down, up, and on your hips. Stand and press your fingers on your breast, working around the breast in circular direction. Lie down on and repeat step 3. Squeeze your nipples to check your discharge. Check underneath the nipples. Treatment: mastectomies, surgical removal of tumor, followed by breast irradiation, about 6 weeks of radiation therapy, typically followed by lumpectomy. APBI, radiation therapy that is shorter course of treatment, which is about 2 weeks, but the radiation would be higher than a whole breast irradiation. Total mastectomy, to remove all entire breast and involve lymph nodes. Remove of all entire breast underlying muscle as well the underarm lymph nodes. Psychological effects: stress, develop certain bad behaviors, lack of support, overwhelmed. Social effects: lifestyle choices, focus on benefits like diet, exercise, low income. You have less access to health foods and quality healthcare. Industrialization: women living in industrialized areas have a high likelihood to develop breast cancer. Support: being involved in a support group such as walking marathons and promoting peak women for cancer. Physical effects: pain. A person will feel pain through surgery or other treatments like chemotherapy. Nausea. A person will tend to feel nausea and ultimately vomit because of the trauma breast cancer will create in the body. Fatigue. A person will feel very tired or fatigued when doing everyday things because the cancer has weakened their physical states. Anemia. A person will begin to develop anemia, loss of red blood cells. Infections and people with cancer. A person will develop other infections because of the lower white cells this cancer tends to kill. Lung cancer. The uncontrolled growth of abnormal cells that start off in one or both lungs, unusual in the cells that line in the air passages. The abnormal cells do not develop into healthy lung tissue, they divide roughly and form tumors. Signs and symptoms: chronic cough, chronic bronchitis, tumors, blood too pure in the sputum, wheezing when breathing, air sacs collapsing or cease to function, pain in chest, shoulder, and arm. Risk factors: smoking tobacco, drinking alcohol heavily, obesity, inheritance, secondhand smoking, certain metals, asbestos, rendered gas. Detection: chest x-ray produce images of your heart, lungs, blood vessels, airways, and the bones of your chest and spine. It can also reveal fluid in or around your lungs or air surrounding a lung. MRI scan: a technique that uses a magnetic field, radio waves to create detailed images of the organs and tissue within your body. CAT scan: an x-ray image made using computerized axial tomograph. Vibrant octave examination is produced designed to assess swallowing function through the esophageal tract. Visualization: an image to examine the perineal and laryngeal structures. Treatment: surgery. A procedure where the surgeon opens the chest cavity to gain access to lungs. An incision is made in the side of the chest and the ribs are spread apart so your surgeon can remove cancerous tissue from the lungs. Radiation: a treatment that uses high energy rays or particles to destroy small cell lung cancer cells. Chemotherapy: a type of cancer treatment that uses drugs to destroy cancer cells. Physical effects: shortness of breath, nausea, vomiting, fatigue, low white blood cell count. Continued low red blood cell count, hair loss, dry mouth, mouth sores, skin rash, diarrhea. Social effects: people with this cancer begin to worry about how other people view them. They feel self-conscious around appealing to their partner. It creates strain in their relationship. It gives a sense of feeling of awkwardness to their peers about talking about his or her disease. Continue. A person tends to get closer to the religion, such as attend church more often or religious groups. A person can become antisocial because of the trauma it can create when diagnosed. It may become harder to go back to the everyday house because of the physical effects it causes. A person can have a hard time to communicate with others because he or she may feel abnormal or different. Psychological effects: a person who first begins to feel in denial with diagnosis. A person will then feel very angry because he or she developed the disease. A person will then analyze the outcome and then have a sense of depression with himself or herself. Because of depression, the person will fear his or her outcome, which may be death itself. In the end, the patient can finally accept his or her untimely fate and begin to cope with the disease. Thanks for watching.